Khi nói đến sắc đẹp là nói đến sự hãnh diện và tự tin. Loan Châu xin hân hạnh giới thiệu đến quý vị Coast Surgery Center, một trung tâm giải phẫu thẩm mỹ với đội ngũ chuyên viên được huấn luyện kỳ cựu trên 25 năm kinh nghiệm, sẽ giúp quý vị có được một thân hình tuyệt hảo và trở nên tự tin hơn, sức khỏe, sự an toàn, thân hình của quý vị và nhất là sự tự tin về sắc đẹp của chính mình. Với những thiết bị hiện đại và tối tân, chúng tôi có đủ điều kiện và đạt tiêu chuẩn hàng đầu nhằm đảm bảo sự an toàn tuyệt đối cho quý vị. Giám đốc y khoa là bác sĩ phẫu thuật được huấn luyện đầy đủ và dày dặn kinh nghiệm. Cùng với đội ngũ bác sĩ Mỹ và Việt có board certified, quý vị sẽ hãnh diện hơn với thân hình của mình khi đến với Coast Surgery Center. Hãy gọi cho chúng tôi ngay hôm nay tại 1855 A New You để được tham khảo miễn phí. 1855 263 9968. Coast Surgery Center sẽ giúp quý vị lấy lại niềm hãnh diện và tự tin.
Chương trình này được bảo trợ bởi Coast Surgery Center.
Và kính thưa quý vị, ngày hôm nay Loan Châu được hân hạnh giới thiệu với quý vị một vị bác sĩ khách mời khác của chương trình sức khỏe và sắc đẹp của chúng tôi ngày hôm nay. Đó là bác sĩ Hyder Mukadam. Ông có bằng board certified về cosmetic plastic surgery và ông có rất là nhiều năm kinh nghiệm về những cái phẫu thuật về quý vị có thể name tất cả cái gì thì ông đều làm những cái phẫu thuật đó rất là đẹp thưa quý vị. Và ngày hôm nay chào đón bác sĩ Mukadam đến với chương trình của chúng ta. Hi doctor.
Hi.
How everything?
Good, thank you.
Thank you for coming to our show today. So I will briefly introduce you to our audience that you have board certified about cosmetic plastic surgery, and you have a very thick experience with, with cosmetic surgery. Can you please let us know that what kind of topics that we will cover right now for this show?
Thank you for the introduction. Yeah, I've been doing mostly cosmetic surgery of eyes, nose, breast, and liposuction and tummy tuck. Occasionally, ear autoplasty, we call it. When the ears are floppy, we can do that also. But mostly I do eyes, nose, liposuction, and breast and tummy tuck. It's been quite an experience. More than 20 years I've been doing it. And I'm very happy with what I do.
So this particular show right now, you will talk about the breast implant, breast augmentation. Could you talk to us more about that, please?
Sure. Breast implant surgery is more common than all the other surgeries put together, especially here in Los Angeles. It gives women good confidence and they feel better about themselves after surgery. If everything goes well and they come out looking good, then there's nothing else that they desire anymore. Even eyes and nose, sometimes they will not so keen on, but breast, it's very important for women to have confidence, yes. So this surgery is done, it's not a big surgery, but still it requires about a week off work, and it takes a certain amount of after care and recovery. Before, the silicone was sticky and stringy and was known to seep out or leak out of the bag and go to different places. The Dow Corning, who used to make that, went out of business and was told to stop by FDA. And then these companies, McGann and Mentor, started working on them and made better implants called memory gel, where they made the silicone more cohesive. So it becomes like not stringy, not thin.
Cannot leak anymore.
Not leak, yeah. Even when you cut the implant and hold it like that, it doesn't fall out.
I see.
It's like gummy bear. I've been doing that for more than 15 years now, and I've never seen even one complication. With other silicone, we used to see every other case was a problem. Leaking or rupturing, even causing some pain and capsular contractures and things like that. In fact, it has been explained in the books that silicone used to travel in the body and even found in the joints and kidneys and things like that.
You mean that after the silicone leak, if it's leaked,
Yes,
it will
leaking
travel inside
through,
your body?
Right. Some people did not believe it, and still, like anything.
It got a bad
there's-
name before.
Yeah, but there's people who are not ready to accept, and then there are people who feel that good thing that we need to take this out.
So with the silicone before, people are afraid of being cancer.
Yes.
So with this kind of silicone, will it affect the body like that?
No,
Or
that's
not?
what I'm saying. I haven't seen. I personally, in more than 15 years that I've done this, I didn't even have to remove them. Even if you remove, it's not leaking. It's not. The shell is intact and it doesn't leak through. So removal is easy. Exchange is easy. You remove and put new implant, and nobody has any complaints.
So you don't see any problem with that?
Right. When you are not doing surgery correctly or putting it in a place where capsular contractures are more common, like when you put the implant over the muscle, outside the muscle, then there are increased chance of contractures.
What do you mean by capsular contractor?
Capsular contracture means that the scar tissue that builds up around the breast implant, any foreign body you put in the body, stimulates a layer of scar tissue around it. We call that capsule.
So make the breast harder?
Right, so that capsule becomes tight and hard, thick capsule. So the breasts become like rocks. When you touch them, they're very hard.
So how can you fix that?
You have to remove the
Remove.
implant. If the implant is over the muscle, put them under the muscle and cut the capsule, put medications so it gets softer.
So you mean the problem with that, because when they do the surgery, they do over the capsule?
Yeah, over the muscle.
So if they do under the muscle, it won't have that
The
kind
chances
of
are less. That
Yeah.
doesn't mean it never happens. Basically, nobody really knows why capsular contracture happens. There are many theories. In olden days, there were theories that it's because of infection, because of bleeding, because of so many different things. The surface of the capsule, the implant, it comes as a smooth implant or rough implant. It's called textured. So some people thought that the smooth implant causes capsular contracture, so they use the textured. But I've seen even textured implant can cause
It's probably
capsular
because of each
contracture.
body. It responds.
That is another
differently,
theory,
yeah.
says your body is like that. But
Yeah.
generally, the most accepted, most easily understood is the one where if you put over the muscle versus under the muscle, because the numbers over the muscle are maximum number of cases have capsular contracture. If say somebody wants to go bigger or smaller or no implants, so you remove the implant, remove the capsule, cut into the capsule, put Canalog like steroid to make the scar tissue softer.
I see.
So those are different ways of dealing with it. But there's no guarantee that it
go
will
away.
not come back.
I see.
The only guarantee is if you remove the implant, it goes away. The whole capsule and the contracture disappear.
The thing is, people don't want to remove it
Right.
forever. They get used to the
Exactly.
shape and the confidence of
Not
any.
only that, then
Yeah.
the breasts will be more loose and hanging.
Right,
and,
hanging.
Yeah, sagging. So nobody likes to go without. But some people do. I just did, maybe 2 weeks or less than a month ago. The
remove
lady
that.
decided I just don't want implants.
I
She
see.
had 2 or 3 surgeries somewhere else in the past.
Right.
And she was fed up with that complication. Nobody likes to go empty.
Right, exactly.
So you have to put something or change something and put new implant. And now that silicone has gotten bad name, some people say, no, I don't want silicone, I want just saline.
Right, right.
But this newer silicone is much better.
Right, compared with saline.
Right.
Right.
Well, that is a different
What is
comparison at all. When you touch the breast, in saline implant, there are certain spots you can feel the water,
I can
saline. Saline means salt water, right? So we have to fill it up with salt water. So there are some areas where you can feel the bag and you can feel the water sloshing.
With silicone,
But
you
with
don't feel that.
silicone, we cannot even tell that there is silicone there.
I see.
It's so soft and it
It's
just
like
feels
your-
like the
Your real
breast.
one.
Yeah.
Your breast.
So between saline and silicone, silicone always is much better choice. But because people had bad experiences in the past, that silicone caused all this trouble, finding it in the joint and
It takes some time to clear that name
right.
out. Yeah.
So now they're scared of having silicone
Right.
implant.
They scared because of that. They scared of having cancer as well.
Yes,
So a
that
lot
too.
of people they concerned about silicone.
Yes, cancer is not as common as people worry about, but it has happened. Yes,
Yeah.
in very few cases they've developed. Recently, actually, they found, but there's no direct correlation between implant and cancer.
And cancer.
Yes.
Right. So before you start any breast implant procedure, would you send them to a mammogram to make sure that breast is okay?
Yes, it's very important to do a mammogram before surgery so you have a baseline. Meaning, if you have to go after surgery, say 2 years after surgery, you
Right.
went to get a mammogram, they can compare with mammogram before surgery
yeah.
with after surgery and see the difference.
Right.
So that way, yes, it's very important. But mammogram in general is required for older women, 30 plus, 35. Younger, like in the 20s,
Don't need that.
they don't really need it.
Right.
But it's good to have one as a baseline
at
and
ease,
to
yeah.
compare with.
Right.
Yeah. So I always tell them if they're young, leave it to them. But if they're older, even 40 plus, I would say you should definitely have a mammogram.
So we need a mammogram before.
even
that.
even if you're not having breast implant surgery, you should be getting a screening mammogram. Routine.
But
Yeah.
routine. Yeah.
So that way, having one before surgery is very important. Yes.
Right. So with the breast implant, is there any risk doing that for
Risk
the patients?
risk is just like any other surgery risk. Anesthesia risk, complications of bleeding or infection. But these are any surgery you do, eyes, nose,
Same thing.
breast,
yeah.
liposuction. There's always chance of bleeding, infection, and deformities. Bleeding, if you take aspirin, ibuprofen, or arnica before surgery, your chances of bleeding are
A lot more.
very high.
Yeah.
So I always tell patients not to take blood thinners or
Aspirin.
medication that
Yeah.
will promote bleeding.
Right.
And then, of course, surgery done from different access areas also matters, because when you do a surgery through the nipple, you can see what's going on, stop the bleeding, control everything, clean everything, make sure there's no complication, and put the implant different sizes, see. But when you do it from belly button or under the arm, it's a faster procedure and you don't really see what's going on. It's almost like blind procedure. So sometimes that is a risky procedure, and I don't do that. I used to do from belly button, but I stopped.
So there's a safest way to do is around the nipple.
Yes,
I see.
as long as you are very careful and not damage nerves and control bleeding, give the right size. My patients are very happy. And when you sew it back together, you put it nicely together, the scars are almost invisible.
How the sensitivity? They still have the same
Yes,
sense?
yeah, that is very important point, because when we used to do the other kind of silicone, we used to put them over the muscle. And when you go from the nipple over the muscle, you disrupt a lot of breast tissue where the nerves come in. So people used to have loss of sensations. But now
Under the muscle
I
is
don't
different.
do over the muscle ever. I have stopped doing it. So we go under the muscle. So you just make one cut, go through the breast, under the muscle, and then put the implant. So 95% of your breast is not even touched.
I see.
So you don't lose sensation. I don't have any patient, not even one, complaining of loss of
Loss of
sensation.
sensation. How big is the incision?
About no more than half circle. So depends on the size of the areola. If areola is a large size, you can even do 1/3 or smaller, but never more than half circle. So if it's a smaller areola, then you have to make lower half circle.
Yeah.
And that makes some limits, like say somebody with small areola wants a very big
Bigger,
size,
yeah.
you cannot put that silicone implant through there. You have to put saline implant and then put water.
Water
Yeah.
inside.
So those things are very important to know. But if you put it together, when you sew it back, if you do it nicely, then the scars are almost not
You don't
visible.
see it.
Yeah.
You don't see it.
Well, if you look for it, you can see it, but it's hard to. Over a period of time, it gets better and better. Okay.
But thank you, Doctor, so much. Let me translate briefly to the audience.
Sure.
Thưa quý vị, hôm nay Lan Chau được nói chuyện với Dr. Mukadam về vấn đề là breast implant, thưa quý vị. Và với breast implant thì có nhiều cái để nói lắm, thưa quý vị. Quý vị có thể gọi vào số 1855-ENEW hay 1855-263-9968 để quý vị có thể có free consultation với Dr. Mukadam. Như Dr. nói là có hai loại implant, thưa quý vị. Thứ nhất là saline, thứ hai đó là nước biển, thưa quý vị. Và thứ hai là silicone. Mà silicone hiện nay bây giờ thì tốt hơn ngày xưa rất là nhiều. Thì ngày xưa nó đã có, người ta sợ tại vì nó có rất là nhiều thứ mà gây nên bệnh cho bệnh nhân. Nhưng mà bây giờ thì với silicone hiện tại được FDA approve rồi, thưa quý vị. Và bây giờ là những cái silicone bây giờ đẹp hơn là saline rất là nhiều và rất là safe, thưa quý vị. Một lần nữa cảm ơn quý vị đã theo dõi chương trình Sức khỏe và sắc đẹp của chúng tôi, và mong quý vị gọi vào cho chương trình tại Cozy Center tại 1855-ENEW hay là 1855-263-9968 để được tham khảo miễn phí với Dr. Mukadam. Và chúng tôi có những cái promotion hàng tuần, thưa quý vị. Quý vị có thể gọi vào và đề cập tới đây là nghe từ chương trình của Cozy Center Sức khỏe và sắc đẹp. Quý vị chắc chắn sẽ có những promotion tốt. Và chúng tôi sẽ gặp lại quý vị trong show tới, tiếp tục với Dr. Mukadam để nói tiếp về những cái gì quý vị thắc mắc về breast implant. Thank you, Doctor, so much. And we think that we have to talk with you again regarding this because we need to know a lot more information. That thank you for educated us. You know, I appreciate it so much.
Anytime you're willing, I'm willing to come back and talk if you want me.
Thank you so much, Doctor.
You're very welcome.
Cảm ơn quý vị. Khi nói đến sắc đẹp là nói đến sự hãnh diện và tự tin. Loan Châu xin hân hạnh giới thiệu đến quý vị Coast Surgery Center, một trung tâm giải phẫu thẩm mỹ với đội ngũ chuyên viên được huấn luyện kỳ cựu trên 25 năm kinh nghiệm, sẽ giúp quý vị có được một thân hình tuyệt hảo và trở nên tự tin hơn. Sức khỏe, sự an toàn, thân hình của quý vị và nhất là sự tự tin về sắc đẹp của chính mình. Với những thiết bị hiện đại và tối tân, chúng tôi có đủ điều kiện và đạt tiêu chuẩn hàng đầu nhằm đảm bảo sự an toàn tuyệt đối cho quý vị. Giám đốc y khoa là bác sĩ phẫu thuật được huấn luyện đầy đủ và dày dặn kinh nghiệm. Cùng với đội ngũ bác sĩ Mỹ và Việt có board certified, quý vị sẽ hãnh diện hơn với thân hình của mình khi đến với Coast Surgery Center. Hãy gọi cho chúng tôi ngay hôm nay tại 1855-ENEW để được tham khảo miễn phí. 1855-263-9968. Coast Surgery Center sẽ giúp quý vị lấy lại niềm hãnh diện và tự tin.
Chương trình này được bảo trợ bởi Coast Surgery Center.